Well, a Sudanese UN medical official fighting the Ebola virus died on Tuesday in the German hospital where he was being treated after arriving from Liberia last week. The St. George Hospital in Leipzig says that the 56-year-old official died overnight Tuesday morning. The medic, who has not been named, was the third Ebola patient to be treated in Germany. Hours after the man arrived in the eastern German city, a doctor at the hospital told reporters the patient's condition was dire, even though he may have been seen walking at the airport. In Britain, critics are questioning the government's response to the Ebola outbreak following delays and indecision over the introduction of a screening process. Britain's chief medical officer warns the country should expect a handful of Ebola cases in the next few months. Henry Ridgwell reports from London.
Britain is bracing itself for the arrival of the Ebola virus.
Yeah, I've just been feeling unwell over the last few days. I've not long come back from Sierra Leone.
This 8-hour nationwide drill Saturday was designed to test the health system and government response. Britain's Health Secretary announced Monday that screenings would be introduced for passengers arriving from the worst-hit countries of Liberia, Sierra Leone and Guinea.
This will allow potential Ebola virus carriers arriving in the UK to be identified, tracked and given rapid access to expert health advice should they develop symptoms.
Some medical experts dispute the effectiveness of screening. Tom Solomon is a professor at the University of Liverpool.
This is a disease which has an incubation period up to 21 days. So if people have symptoms when they leave a country in West Africa, that will be picked up. And there's very little to be gained additionally from screening people again 10 hours later when they arrive in the UK.
Britain said last week it would not introduce screening, but then reversed the policy. The government response has been inconsistent, says Sophie Harman of Queen Mary University of London.
Reactionary, haphazard, and yet again another U-turn.
But Harman says Britain's National Health Service is capable of dealing with an Ebola outbreak.
If a case of Ebola does come to the UK, and increasingly we think that is going to happen, we do have a robust health system to deal with this issue. And I think that was an important message that the government has slightly lost by introducing these kind of border restrictions, which are quite facile at best.
Any Ebola patients in Britain will be taken here, the country's only high-level isolation unit at the Royal Free Hospital in London. Doctors at the hospital, like Stephen Mepham, say there is no need for the British public to worry.
Britain is a very different environment to West Africa, and it's inconceivable to think that the virus could travel in the same way as it has in healthcare settings in West Africa.
Workers for Britain's National Health Service staged a 4-hour strike Monday over pay. Christina McAnear of the Health Workers Union says government cuts could undermine the airport screening programme.
Due to cuts in NHS funding, that the health staff who work at airports are actually being cut.
The government insists the country is well prepared. Health professionals say it is very likely the disease will soon arrive in Britain. Henry Ridgwell for VOA News, London.
On a battalion of 800 soldiers awaiting deployment as peacekeepers in Somalia are now under quarantine after one of its members tested positive for Ebola. Spokesman for Sierra Leone's armed forces says the soldier was infected after leaving the military camp where the force is based without permission. The soldiers were due to relieve the nation's contingent already deployed with Somalia's African Union peacekeeping mission, AMISOM. They will now be subject to a 21-day isolation period.